first of all, we need to fill with the quick form.
Okay.
The client will be asked questions about her health condition and medical history. This includes details about medications she is currently taking, any existing diseases such as high blood pressure, any history of plastic surgery, allergies, keloid scars, and more. Stay tuned for a more detailed explanation.
I'm here for the rhinoplasty surgery.
That's correct.
Now, please elaborate. What is your main concern about your nose and what you would like to improve?
So my main concern is when I wear glasses, so functionality and of course aesthetics. So when I wear glasses, I don't have a bridge, and so the glasses always seem to fall. So I wanted an implant, so then I would have a high bridge. And then also for aesthetics, I just feel like my alars are a little wide. So if I got a tip plasty and pulled out my nose a little forward, then it would reduce the size of my alars. So higher bridge, of course, and then narrow nose. I do have a reference if you want to see. I don't know. Of course, you probably know. I like Lee Hyori's nose. It's kind of like that small, cute nose, and then the tip comes out.
Basically, you need just to enlarge like the bridge. So we proceed with the implant insertion, right? And for your tip, we also need to make it bigger. So we proceed with the tip augmentation as well. But as for your alars, like nostrils, they're not that big, so no need to have any surgeries on that.
Okay. How long is the procedure gonna take?
Average 2.5 or 3 hours.
And am I gonna be under general anesthesia?
Just sedation, which is sleeping anesthesia, not general one.
And then usually, how long is the healing process?
So first of all, your nose will be packed with the cottons and
I'll have cotton gauze
yeah.
packed in my nose.
Yes,
oh,
right.
okay.
And
how do I breathe?
You cannot actually breathe properly for a few days. Yeah, so that will be removed on the second or the third day after the surgery. And after that, the stitches will be removed on the 7th day. Until then, you also need to keep the splint on your nose, which provides support for your bridge. And as for the swelling, it actually takes like 1 or 2 weeks to fade away, like the major swelling. For the minor swelling, especially for your bridge, it will take around 6 months to see like the difference and like basically see your nose much smaller.
So is it a total of basically 3 appointments? So I'll come back for surgery, and then I think you said 2 days later remove the cotton gauze. That would be the second time I come back. And then the third time would be 10 days later to...
No, 10 days, 7 days.
Oh, 7 days later to remove the stitch in the cast? Oh, okay. And then no more checkups? That's just 3 appointments, right?
I actually can arrange some additional checkups if you want, just to check that the healing process is going well.
Oh,
okay. So you can meet the doctor after 1 month. Usually we see like the first result and check with the doctor. Yes.
Oh, that sounds great.
Yeah, you actually need to let us know your height and weight.
I haven't weighed myself in 3 weeks, so I think I may be down 61 or 62.
Before we continue, check out seoulmedical.com for more information.
Are you my doctor?
Yes,
I'm so excited.
So let me show you the implant to use. Same shape, different heights.
Oh. So is it just one implant that's gonna go in my nose?
Yes. We use this kind of implant.
What is the material made out of?
Silicone.
Oh, okay, silicone. And it's not gonna move? It stays in place?
In ordinary, the implant doesn't move.
Well, I kind of showed her the reference. Of course, I kind of like Lee Hyori's nose. I do want a small, narrow nose.
So we try to put like on your nose this implant. Actually use the implant, the silicone implant just for your bridge. As for your nose, we use the cartilage, which can be harvested from your ear or septum or a rib. So it depends on the result you actually want to achieve.
Okay.
Different shape, but the height is, I think this is good for you.
So we just use like 4 and 5 millimeters of the implant. So this is the 5 millimeters.
Oh, so it's like a little thicker.
Yes, a little bit. So you can choose which one you would like.
Do you think maybe thicker is probably better? Because it's so flat here, right? Like there's actually nothing here. So this is a little thicker. It gives me more. That's probably, do you think that's too much?
Not too much.
Well, I like the 5 millimeter.
So basically we just shape the implants
Okay.
and like try to fit it for your nose shape.
Oh,
So
okay.
basically we need just 4 or 5 millimeters of that implant to enhance, to enlarge your bridge.
Okay.
The inside you have like the septum cartilage, right?
Okay.
You can use the septal cartilage to enlarge the tip. This way.
Okay. So you're gonna use my septum cartilage instead of ear or rib cartilage.
Yeah.
Okay. It'll be enough.
Well, you can
Yeah, I think.
basically have like
A flat
lower
nose?
bridge, yeah, flat nose. So basically we just fill this space with the implant.
I'm excited.
Typically we choose the 5 millimeter for now, but it can be changed during the surgery because we need to check inside of your nose.
All right. Sounds good.
So basically you can see this is the shape of the original implant, but we use just that much to get higher bridge.
Oh, okay.
We just shape this part. To achieve more like balanced look, you actually need to enlarge like both tip and bridge as well to have like more balance.
Right, so you gotta do here and also the bottom part, right? You gotta pull it out forward.
Yes, exactly.
Okay. Oh, it's very flexible.
Yeah, we need to check the
You
flexibility
can
of your
put-
skin
I have to
with
check.
the Q-tip. So you can come closer to the doctor.
Okay.
So we actually just hold it a little bit in order not to your nose like to lose this shape. Okay. So we need to slightly lift through tip.
I'm excited.
Thank you so much. Do you have any additional questions for the doctor?
Do you think I'm a good candidate because it's just a very simple procedure for my nose, right? I don't have anything to like reduce, or I wouldn't need osteotomy or anything, right? It's just very simple, right?
It's quite simple surgery, so we just do like bridge augmentation and tip plasty fading.
Okay, sounds good.
Explain you the not possible outcome for you.
Okay, so the limitations.
The limitations, yes.
Okay.
So we actually cannot lower your tip like that much.
Okay.
So it's possible to do it this way. By view first of all.
Okay.
So this is how we lift your tip.
Okay.
So basically the nostril shape is not gonna change. Just slightly we lower your tip.
Right.
So compared to like your bridge, you will not see like a gradual change with your nostril.
Right.
Actually, the incision goes on your columella.
Incision is right over here.
So we'll show you
Okay.
the incision side exactly.
Incision is visible here.
Oh.
Inside
Inside.
is not
Okay.
visible, but there.
So incision is here, and then you just lift it up.
Yeah. The incision is not only here, but inside.
Inside of your nose and kind of in the middle of your columella.
Okay. So it's not very noticeable.
Yes. Do you have any additional questions for the doctor?
No, I think he explained it very well. Yeah, it's very thorough. Thank you so much.
So we need to come by 10 a.m. September 5th.
Will I be hospitalized for one night, or do I just get the nose done and then I can go home right away? Oh, okay. So after
30 minutes.
surgery, how long will I be in the recovery room for?
It's around 30 minutes or 1 hour.
And would I be able to eat or drink right after, or do I have to wait, a few hours?
You need to fast for 8 hours before your surgery. It includes like water, food, candies, like nothing you cannot consume actually before the surgery.
Okay, 8
And
hours.
after the surgery, you can start drinking water maybe in 1 hour.
Okay, so 8 hours of fasting, no food, no water, no candy, nothing. Okay.
So I actually recommend to proceed also with some recovery IVs, and which includes like some nutrition, like vitamins and painkillers to help you with the faster recovery.
Okay,
You actually
no nail
use
polish?
nail polish on your toes and nails as well. This is actually the end of our consultation. How do you feel about it?
I feel good. You were so great. It was nice to meet you.
Thank you. Nice to meet you. You were done with your consultation. How was it?
It was great. The consultant was really knowledgeable, and the doctor also was really great. He thoroughly explained everything, and so I'm really excited.
Perfect. A little nervous or just excitement?
I think it's just excited. I was nervous a little before meeting them, but after meeting them and they just reassured me of everything, I feel great about it. So I know I'm in great hands.
Well, thank you for putting your trust in us, and we will see you on the 5th.
Okay, see you then.
Bye.
Bye.